public health is everywhere, from the sidewalks you walk on to the grocery stores in your neighborhood. My guests on this episode break down what public health really means, why it matters beyond hospitals and clinics, and how explaining it in plain language strengthens community support for the work that we do. You're listening to the PHEC podcast, episode 437. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Just depends upon the needs of our clients. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we may be able to support your organization as well. Links will be provided in the show notes. This is another special conversation in our What is Public Health series, and I'm very excited for you to meet our guests on this episode. Ashley Harris, a recent MPH graduate and health advocate, joins Dr. Eboni Haynes, CEO of the Mahogany Group and public health scholar, for a candid conversation about explaining public health beyond academic circles. They explore how to communicate public health concepts to family and friends using real-world examples like food deserts, built environments, and transportation infrastructure. The conversation moves from personal storytelling to policy impact, including Dr. Haynes' work integrating public health expertise into planning commissions and her innovative approach to bridging healthcare and faith communities. Let's connect my conversation with our guests right now. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. All right. Thank you both for joining me. I'm really excited for our conversation in this series that we have, What is Public Health? Let's jumpstart everything with a round of introductions. This is going to be relaxed conversation. I've got two wonderful colleagues joining me today. So we'll start with you, Ashley. Why don't you just take a moment to introduce yourself?
I'm Ashley Harris. I didn't put in my bio MPH, but I am a recent graduate from Emory University. I am an advocate in public health. I specialize in healthcare management, basically health coordination, logistics, project management. Those are some of the things that shifted me and geared me into wanting to pursue public health management even more. Right now, I am a assistant teacher to preschoolers within my local community, and I am a loving person who enjoys educating and being a part of communities.
Thank you so much. That's a wonderful introduction. I appreciate that. And Dr. Haynes, please introduce yourself.
Hi, everyone. I am Eboni Haynes. I am the CEO of the Mahogany Group, which is a public health management consulting firm in the Atlanta metro area. We pretty much provide strategic guidance on health policy, program implementation, and evaluation, and also health communications. I have a background, obviously, in public health. So my master's and PhDs are in public health. And I also recently completed a Master Divinity program at the Handler School of Theology at Emory University. And I'm looking forward to being here and having this conversation with you both.
This is wonderful. We were chatting a little bit before we started, and we didn't plan this little, Emory reunion here, but it just worked out that way. This is also, I'm looking forward to the conversation because this is it's somewhat challenging for us in public health, but I'm passionate about all of us being able to more succinctly and easily explain public health in plain language to communities that we serve, but really thinking about like our friends and family, those people closest to us. And it's something that we've heard so much about in public health. And we think as an industry that we're really clear because it's clear to us, but to people who are outside of public health, they're still not quite getting it. I firmly believe that when we can help people understand just on the community level, people understand and value public health, we're not so easily removed and our programs are not so easily erased because they understand and that value is increased for them. So we have more of a community buy-in, which helps our advocates sort of upstream there with all the things that we are trying to do to rebuild public health. So this series is a way for us to just jumpstart that with conversations about what public health is. So I'm going to ask each of you the same question. And I'd like for you to we're going to go in the same order. We'll start with you, Ashley. Just provide your response to the question and no pressure where it's not about, nailing it or not. It's really, it's an evolving process. So it's a conversation, but really take a few moments and answer the question, Ashley, what is public health?
So that is such a broad question to ask because public health, as we know, is so wide. But some of the things that I wrote down just basically about public health is that it's a multifaceted field that basically combines science with a mix of an art of preventing disease. That's how I see it. It promotes wellness, it improves communities' health, and it emphasizes research, health systems strengthening, community engagement, as well as education to ensure populations receive proactive care rather than reactive. That's some of the main ways that I try to get people to see it. Because when we think of hospitals, that's more of a reactive way of responding to the people, our communities. But when I think of public health, I think of it as a superhero. I honestly do. I think of it as a multifaceted superhero that is trying to prevent versus react. So it's like the air you breathe. Public health is everywhere. It's needed in every way and is there to improve communities and populations rather than react. So we want to get out there and be around and we're everywhere as much as possible. So that's like the synapses that I can think of about what public health means to me.
Thank you for that. I'm taking some notes, and I'm going to come back and share some thoughts. But I really appreciate your approach and your explanation, and kind of even you even explain kind of why you say it a certain way. So we're going to give Dr. Haynes a chance to answer, and then we'll talk about both your responses. So, Dr. Haynes, same question for you. Like, what is public health? How are you answering that question?
So actually, I love the superhero metaphor. I am going to have to use that in my classes. I promise to give you attribution. But, when I think about public health, I really think about all the things that ensure that we are creating the conditions for people to achieve optimal health. What is a person's best ability to be healthy? And we're also, like you mentioned, Ashley, looking at how can we make sure that those conditions are present before someone gets sick? And so often we think about public health as being systems like clean water systems or safe food supply systems. And most people don't even think about public health until a system like that fails. But public health really is, extending beyond infrastructure. And so when we think about public health, we can think about all of those individuals who do work to ensure that when outbreaks happen, they know about it and they're on top of it. We can also think about vaccinations and how vaccinations help prevent people from getting sick. We can think about health education campaigns. So, how do we educate people on topics and language that they can understand so that they can be proactive in taking charge of their own health and preventing themselves from becoming sick or disabled? And then also we can think about public health in terms of policies that are designed to protect entire populations. And so often when we think about public health policies, we might think about seatbelt laws. Well, why did seatbelt laws come into play? Well, it was because people were becoming injured and dying because when they were in car accidents, they didn't have anything to prevent them from the impact that was causing them to lose their life or become severely injured. And so, there have been hundreds of laws that are considered public health laws that protect us to ensure that we're not becoming sick and we're not becoming injured or dying as a result of something that was more than likely preventable.
Thank you for that. Great responses, both of you, and both are I still think of as like great conversation starters because if you lead with in both cases the way you both explain public health to someone that a friend, family member, these people are invested in what you have to say. They want to understand, this public health thing that you're doing, right? This industry you're in that sets them up for some great follow-up questions in both scenarios. I want to touch on Ashley's. I want to go to Ashley's response first. And yes, I did like the superhero response as well. And I've heard that a few times. I think it's so fitting because you think of a superhero, sometimes they're like secret in disguise. You don't know until there's a crisis and they come out in the suit, which is exactly how public health is. We're existing quietly in the background, doing what we do. And that's perfectly wonderful and fine, but I think the part that we need to do more of is still talking about and selling like what we do, talking about what we do in the background and why it's working so well. I love that superhero analogy, but I also love that you brought up the proactive versus reactive because I say that a lot, but you said proactive is, the public health you explained. You said preactive or reactive is more like healthcare. Not that it's bad because we do need that. If I break my leg, please get me to the emergency room. If I'm in an accident, I want to be there. But I like that you framed it that way. I think that's a way that people can those with that example can help people to understand. Um, are there some can you recall a time either well, you mentioned that you work with young children now, but like with your friend group or family where you've gotten some follow-up questions and like how you engage in a conversation where they're really trying to understand and really using language to help them understand this concept of public health?
That's a great question. Some of the ways that I try to explain it to friends and family around me, especially family, because most of my friends now are either in the same field as me or in similar fields such as social work. So we sort of have those conversations and it's just like back and forth. We understand. Uh,
Right.
but when I'm explaining to family and new people that I'm meeting, I try to think of it in a sense of saying public health is a field of science that studies how to you study the environment of people and preventing them from getting to a point of no return. And that can go in many ways of try to saying it in simpler terms off the top of my head. Just basically a science that gets people to see how they can better themselves, better their daughters, their sons, friends, family, school systems, built environments, just eye awakening field. Because when I initially got into the field, I didn't even know what a built environment looked like. And as I learned more about what a built environment was, I looked around and I was able to say, I'm living in a built environment. I didn't know what food deserts were, where you're living in an area that has almost one grocery store almost 5 miles away. You're living around unhealthy environments such as fast foods. You're living in areas where there are more liquor stores than there are farmers markets. So it's more about a science or field that is to get people to understand more about prevention more than anything. And that can look in multiple ways, like Dr. Haynes had said in policy, it can be in epidemiology. Because it's so broad, it could be like the only way I can get it into one short answer is just prevention of care, getting people to understand how important it is to treat yourself and know more about what it is to understand more about how it is to just care about your environments and yourself. So public health can be in so many ways, but I would say to friends and family, it's just a field about proactive care.
You
Just
did a
simple.
You did a great job, Ashley, and I appreciate you being on this. You let me put you on the spot with this, so to speak, and not intentionally, but really and truly, this is hard to explain sometimes, right? We think it's easy to talk about with our colleagues because we get it. It's a
Right.
lot harder. It's a bigger challenge with family and friends. But I think that some of the things that you mentioned, for example, when you talk about understanding the food desert and built environment and the I think, like, you could use that when you're talking to your family and friends and explain to them what that is and, like, turn the light on for them to get them to start paying attention to realize, "You know what? We're far away from a grocery store," and start counting how many liquor stores are here versus how many grocery stores,
And
and
it's that simple because public health is that wide of a range that you may not understand it. And that's where the education within public health steps in because it's that broad of a field. So a person may think, "Oh, I'm healthy, I go to the doctor." But you don't understand that built environment plays so much into your everyday role of not being physically active. It's so wide that the only thing that I you could possibly say is proactive care and follow up with an example.
but I'm gonna interject this here. I want
Okay.
you to understand that I think that your story and your example, especially when you start talking about those examples,
Mhm.
the grocery store versus the liquor store, and it's like, oh my gosh, I'm realizing this. That's what I think would be great for you to use when you're explaining to your family. You don't need to make it more scientific, like, start with a story because 'cause they'll get that, and I
Okay.
think that that would because for me, for a long time, I would just not really try to talk about it because it was just hard to
Mhm.
explain, but I think those kind of examples, you just start dropping little bits and then connecting the dots with them because I think they will understand or start looking around, like I said, well, there are a lot of liquor stores, or, I don't, it's mapping out how far the grocery stores are, and they're going to start paying attention and practicing the public health. And then after a while, you can start connecting and bringing them to and letting them understand that this is a part of public health, making sure we have access to fresh fruits and vegetables. And more access to that than we do the liquor stores, for example, in the city. So like, when you can just giving them those examples, I think those are some of the great ways to be able to explain it to family and friends that they're not gonna, like, all of a sudden grasp all of your graduate level education, like, on the level that you understand it, but meet them where they are. It's sort of the reverse when you have somebody that's in a completely different field from you, and then they're trying to explain it. You want them to break it down and just give you, like, a little bite-sized piece. So, like, you've got some great stories there. I just thought that I could lean in a little bit because this is just exactly how we all find ourselves trying to
Mhm.
explain it, myself included, trying to figure sometimes I'll get caught off guard and somebody go, "What's epidemiology?" I'm like,
It's so
you know?
worse. It's like, gosh, if I just talking to your friends and someone in your field is like, "Oh, yeah, she knows." I don't even have to explain the conversation start from the phone. And then when you're talking to someone else who doesn't understand, you're just grasping to try to figure out what is the perfect word to just put into what you're thinking.
But
So
that's exactly why I'm having this series is that's why we're here. I think this is wonderful. I'm gonna move over to Dr. Haynes because I would love to hear your thoughts here. Anything you wanna add to that before we jump into your response?
Sure. So I think Ashley is spot on because public health is so interdisciplinary. there are so many ways that you can engage people in conversations about public health that connect to whatever discipline it is that they are familiar with. So I didn't really start getting questions from my family and friends about public health COVID, until the COVID pandemic. And then I guess because public health was the discipline that was referenced on the news and in the media as it related to COVID, and then all of these public health professionals started being interviewed, then people started saying, oh, well, Ebony's a public health professional, right? Let me connect with her. And so most of my friends and family did not ever talk to me about what I did until the COVID-19 pandemic happened. But one of the things that I tell my students is that public health is so interdisciplinary that you should be able to connect what you do to any discipline. When I was working in Pennsylvania, for example, on a CDC funded project, one of the things that we were able to accomplish was to help the planning commission in the county where I worked understand that it was important for them to have public health professional as a member of the planning commission, because we were able to, during those meetings, articulate to them that while you are doing your transportation planning, your parks and recreation planning, when you are working with the municipal leaders around the county, they need to have an understanding of the importance of developing the infrastructure in such a way that people don't have to rely on cars for their transportation. And there are people who like to ride their bike. Some people need to ride their bike, right? So you have some people who must ride a bike or walk in order to get to work, and others who don't necessarily need to do that. They have access to other forms of transportation. But our infrastructure should be created in such a way that everyone has the ability to walk or bike safely to work. And then you have other needs. For example, and I'll use the Pennsylvania example again, we had a lot of people who lived in rural communities in this particular county. And so it's very difficult for an individual to receive a recommendation from their doctor that they need to be more physically active, right? So if your doctor tells you to go and walk 30 minutes a day. If you live in a more urban area, you have access to sidewalks that may not necessarily be a problem for you. But if you live in a rural community and there are no sidewalks, and a person, if they decide to walk, they're going to have to walk on the main road that might have 18 wheelers on it. If people are not tying up their dogs in particular, right? That becomes an impossible situation for someone who may want to walk for their health in their community. And so the more we can connect people with you, like real world examples, like you were discussing, Dr. Huntley, they start realizing, oh, I need to think differently about the work that I'm doing. And so now in this particular community in Pennsylvania, the Planning Commission now has a requirement for one of their planning commissioners to be a health professional so that they can get that expertise that would have been missing in order for them to make decisions that are more data driven, especially when it relates to improving the health, and not just looking at how can we ensure that we can move traffic better through our county. And I think that that's where we can make the big changes, right? When we have those policy changes, even when it comes to who's on our boards and commissions, I think that's when we are really able to move the public health needle forward.
Oh my gosh. It's such a great response and such great examples because not only are we talking about, really, you guys both covered the broad spectrum from friends and family, casual conversation, up to more of like our colleagues and partners in industry so that decisions are made on a higher level, like you said, to have someone with this expertise in making decisions that are filtered through a health lens, a public health lens. Excellent example. It makes me think about you gave some categories, in your response to the question, what is public health? You talk about systems and infrastructure and you told us a bit about your background and touching on your recent credential with divinity, so in faith houses and in churches, and How do you see the benefit of being able to, because I know faith-based partnership with public health is longstanding and is, very successful. People come to the churches and the faith-based communities and leaders for answers, and there's trust there, whereas maybe traditional healthcare outlets, not so much. So how do you think the understanding of public health filtered in at this level in a relatable, understandable way can be beneficial? And how do you see, or maybe you've got experience of, being able to, explain and help people to understand in this intersection?
Great question, Dr. Huntley. So, a few years ago, I had the opportunity to do some work with a pastor of a large church in a particular community. And one of the things that I was blown away by was the fact that they had not only a gym in the church that was open to the community, but they also have a primary care practice in the church. And I was so blown away by that because in my training in school, I never saw a model where there was a primary care practice in a community of faith like that. And so that really sparked something for me that where I wanted to learn more about how the faith community could be a better partner or how healthcare systems could be a better partner with the faith community. And so that started a little bit of a journey toward this master's divinity degree. But one of the things that I am working to do more of is help bridge that gap between healthcare and the faith community because we recognize that in certain communities, like the Black community, there is a there's this historic distrust that exists as it relates to healthcare, but there is this historic trust within faith communities. And so if healthcare comes together with faith leaders, then there should be there should be a reduction in people who are delaying care, especially if those messages are filtered through trusted partners in the faith community. And then individuals then would pursue care. Now, in the past, a lot of the public health work that has happened within faith communities has been led by researchers who
Mm.
are not necessarily connected to those communities of faith. And so there tended to be a power imbalance, if you will. And so, how do we make sure that our communities of faith are armed with the education and resources and all the things that they need in order to lead the charge in terms of improving health outcomes within faith communities? That's what's really of interest to me. And I'm hoping to train help faith communities on public health, but then also help them use data to better inform the type of interventions that they're doing with their membership. And so often we hear pastors saying, well, I know that we have diabetes in our community, our faith community, in our congregation. I know we have high blood pressure and hypertension, but to what extent? They don't know, right? Until a family comes forward and says, oh, we're dealing with substance abuse or substance use disorder. We don't really know the extent to which that exists within the congregation. And so if we don't know the extent to which it exists, then how can we put forward interventions that can help communities of faith, those trusted individuals within that community, help those families to deal with whatever it is that they're dealing with? And so some of the work that I'm doing is helping faith communities to collect that data and then use that data to inform the type of programs that they're implementing, the types of partners they're seeking out within the community, and helping to connect their members to those resources so that their members can, like John 10:10, I'm in the Christian tradition. So like John 10:10 says, live life and live it more abundantly.
Mhm.
And so if you're struggling with any type of health condition, then that limits your ability to live life and live life more abundantly. So how can faith and public health come together to make sure that that is an attainable goal?
I imagine you have these plain language conversations on a regular basis.
Oh, yes.
So,
Oh, yes.
yes. Very, very, thank you for that
Mhm.
insight. That's I had never heard of. I've never witnessed myself, primary care within church, although I did attend a large church in, my area for a while that had counseling services that were
Mhm.
part of the church, and it was not just like a Christian counselor. These were licensed and, professional counselors that were just part of the church system, so but primary care, that's innovative.
Great work.
Hmm. And this probably was 10 years ago now.
Wow. Okay.
More than 10 years ago now. Hmm.
Yeah. As we begin to kind of wrap up, because this has been really a great deep dive into communicating public health, plain language, some of the examples of how we can do this. We really did a dive on both of your responses. But as we wrap up, do you have any final thoughts that you'd like to share? I know I appreciate you both for making time to join me and to engage in this panel and to just be very organic as we, kind of go through the conversation. Ashley, is there anything that you'd like to say as we wrap up?
Another thing that popped into my head about public health is basically just meeting people where they are to provide them with the care that they need. I always think of that picture of health equity, where it's, providing everybody with the same opportunity to be able to look at the game over the fence. And that's what makes me think of public health as well, just being able to provide or meet people at the level that they're at, no matter what it looks like or no matter what field of public health. So just being able to meet people where they are to give them that care that they deserve or need. And I appreciate you all for having me. Dr. Haynes, your work that you're doing is so great. It's great to hear about it. That just opened my eyes and just made me think about my church and ways that I can contribute in different ways. So great work. Thank you all for having me. I love to meet new people from public health and get to meet women of color that are doing great things. And you all give me inspiration. So I thank you so much for even having me.
Oh, well, thank you for those really kind words, Ashley. It's wonderful to have you be a part of this conversation. And my dear friend, Dr. Haynes, any final thoughts from you?
I would say one thing that my husband definitely knows for sure is that I see public health in everything.
Mhm.
So um, I think that the more that we recognize that no matter where we are, what we're doing, that thing is connected to public health in some way, right? Whether you're driving down the highway, whether you are in the grocery store, whether you are at your child's school, whether you are at the gym, whether you are, going through the airport and putting your water bottle up to get some water before you head through the gate. All of those things are public health. Everything that we do is connected to public health. And that also means that all policies are connected to public health. But all funding that we appropriate in the U.S. is connected in some way to public health. Public health is that thread that runs through everything, and I think that the more people realize that every time there's a decision made when it comes to funding or policies, that there are public health impacts, then people might see more of the benefit of public health professionals and the work that we do and the types of projects that we work on. And they would then also maybe advocate more for public health resources to be appropriated, whether it's at the federal level, state level, local level, to do this very important work. And so I would just leave everyone with the fact that public health is that through line through everything that we do here in our country. And so please appreciate the work that public health professionals do. Please appreciate um, the funding that is made available to public health professionals to do that work and advocate for more funding, more resources, more professionals.
Well, thank you. Well said. Thank you both. This has been wonderful. I think this has given our audience some food for thought, some inspirational ideas that they can incorporate in how they're communicating public health, and maybe the encouragement to start talking a little bit more to people around them, their family, friends, about public health, their colleagues and coworkers. So thank you both. This has been fantastic. Keep doing the amazing work that you're both doing. And I look forward to keeping in touch with you as well.
Likewise, thanks so much for hosting these very important conversations. We definitely need more of them. So I appreciate you for all you do.
Thank you.
Yes. Thank you. Thank you so much.
I really hope you enjoyed that conversation as much as we did. This conversation reinforces that public health expertise becomes more powerful when we can explain it clearly to everyone, not just our colleagues. Whether you're helping family members recognize food deserts in their neighborhoods or advocating for health professionals on planning commissions, plain language communication strengthens public health. When communities understand how public health shows up in their daily lives, from safe bike lanes to trusted partnerships in faith communities, they become advocates themselves. Your ability to meet people where they are and explain public health in their language is essential to the future of our field. I encourage you to connect with Ashley and Dr. Haynes and learn more about the work that they're doing. You can find links to connect with them on the show notes page. The show notes for this episode, which is episode 437, can be found at phecpodcast.com. Once you're there, just navigate to episode 437 to find the show notes. One more thing before we go. Remember that our podcast has an app and a private community where you can engage with public health professionals around the world. You can download our PHEC podcast community app in your mobile app store. It's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.